Mr. President, I rise today to talk about our drug crisis, the prescription drug crisis. Every day someone in our nation dies, a son, a daughter, a parent, from a drug overdose. Most are from prescription drugs, from opioid painkillers, drugs intended to bring comfort and too often bring tragedy. Oxycodone, hydrocodone, OxyContin. We have an epidemic of these prescription drugs and the abuse of them. Drugs that wreck lives, wreck families, wreck entire communities. In my home state of New Mexico, we know this all too well. We have the second highest rate of drug overdose deaths. We are in a crisis, and it's getting worse. More New Mexicans are dying from drug overdoses than ever before. It touches home, and it hits hard. One of those we lost was a young man named Cameron Weiss. According to the Albuquerque Journal, Cameron was 18 years old, an athlete, a poet. Then he became addicted to painkillers for the treatment of sports injuries. That led, as it often does, to heroin. Within 2 years, this promising young man, with his whole life ahead of him, was dead from a heroin overdose. His mom, Jennifer Weiss, took her grief and put it to work to help others. She founded a group called Healing Addiction in our community after Cameron's death, helping other young people struggling with addiction. Something tragic has to happen before change happens, she told the Albuquerque Journal. Unfortunately, when it comes to heroin, that tragedy happens all the time. Most of us know young people like Cameron. A similar story of another young life lost from heroin overdose was shared with me just last week. This young man's father, who visited my office, is a medical professional in New Mexico. With all of the resources and knowledge available to him, he still was not able to prevent his son's tragic death last year at the age of 22. One of my own staff members, who was raised in Albuquerque, lost 4 of his friends at Cibola High School. All 4 turned to heroin after abusing prescription drugs. One was his best friend, Michael, whose life was cut short at 30 years old. We see this pattern time and again. A person becomes addicted to painkillers, then turns to another prescription or to heroin, which is cheaper and easier to get. It's a lethal combination and a downward spiral. We've all heard the numbers, and they are chilling. Opioid-related deaths quadrupled nationally from 2002 to 2013. In 2014, nearly 30,000 Americans died from prescription opioid and heroin overdose. More Americans die each year from drug overdoses than from car crashes. Addiction knows no boundaries of race, of gender, or background. But our Hispanic and tribal communities in places like Rio Arriba County, New Mexico, are ground zero. Rio Arriba County has the highest rate in the nation, more than 5 times the national average, and this is year after year. Just a few weeks ago, KOB-TV reported on the toll that this is taking. Generation after generation casting a long shadow over the beautiful Espanola Valley. A young man named Rufus Billy said, and I quote, "Growing up here, they'd say this was the heroin capital of the world," end quote. For many, prescription drug painkillers come first, and then heroin comes later. According to KOB, prevention groups report that 2 million opiate prescriptions were filled in New Mexico in 2014, double the number from 10 years ago. The abuse is so severe, according to Rio Arriba County Sheriff James Lujan, that, quote, 6- and 7-year-olds are talking about grandma and grandpa being addicts. It's like a never-ending cycle, end quote. New Mexico is on the ropes, and so many other states are as well. I've listened to my colleagues from both sides of the aisle. The stories are heartbreaking, and sadly, we are losing the fight. Mr. President, this just is not about numbers. It's about families and communities torn apart. And too often it is a story of looking for help and not finding it. We can change that, but it will take more than words, more than hand-wringing. It will take a real commitment, and let's be clear, real money. Rehab saves lives, not always. That is a tragedy all its own for some families. But treatment certainly can't help when you can't get it. People are desperate, trying to get treatment, trying to get help. We see this every day, especially in rural states like New Mexico. That's why we need to pass the Comprehensive Addiction and Recovery Act, because this isn't just about addiction. It's about recovery. It's about giving hope to those who feel hopeless. I'm proud to co-sponsor this bill, and I want to thank Senators Whitehouse and Shaheen for their leadership. CARA will help states and local communities fight this battle for prevention, education, treatment, and law enforcement efforts. CARA is a step forward, and we urgently need to move forward. We can't keep falling behind. In Spanish, C-A-R-A, cara means face. We should remember the faces, remember our loved ones. These are not just statistics. That's why I've also introduced legislation to improve monitoring of prescriptions and for better referral of addicts to treatment services. It also directs the FDA to review naloxone, which is an important life-saving medication for over-the-counter use. Mr. President, there's no doubt that we have a crisis. We can't just say what works. We need to pay for what works. Our commitment has to be equal to the challenge, so I'm quite disappointed that last week we did not pass a key amendment for additional emergency funding. Let's step up to the plate and get this done. I yield the floor and note the absence of a quorum, Mr. President.